Stop whatever you're doing right now because what you're about to hear could be the difference between waking up tomorrow morning fully intact and not waking up the same person at all. Here's something most doctors never get around to telling you in a standard office visit. The majority of transient ischemic attacks, what physicians call TIAs, and what most people know as mini strokes, don't happen during the hustle of the day. They happen in the quiet, in the dark, while you're completely unaware. And your 15-minute appointment simply doesn't leave room for a conversation this important. Now, I want to be clear. I'm not saying this to frighten you, but the clinical data on what unfolds in the sleeping brain after age 65 is frankly extraordinary. And most people who are at risk have absolutely no idea it's happening to them right now, tonight, in their own beds. By the end of this video, you'll know exactly what triggers mini strokes during sleep, why the risk escalates so sharply after 65, and, most importantly, 5 specific actionable steps you can begin implementing as early as tomorrow morning to protect your brain while you sleep. Before we get into the full breakdown, let me tease 2 things that are coming up. Number 2 on today's list is something I'd wager nearly everyone watching this does every single night before bed, but almost certainly not in the way that actually protects your brain. When you hear it, it will completely change your bedtime routine. And number 1, the top factor on this list is something that over 70% of adults over 65 are getting measurably wrong. And correcting it alone has been shown in peer-reviewed research to reduce TIA risk during sleep by a clinically significant margin. Do not skip ahead. The order here matters, and each point builds on the last. We're counting down from 5 to 1, ranked from highly important to absolutely critical. These are the sleep phase TIA risk factors that neuroscience has now identified with remarkable clarity, and every single one of them is modifiable, meaning you have real power here. Let's begin. Number 5 is something almost everyone dismisses as too simple to be serious, and that dismissal may be quietly costing them years of healthy brain function. It's sleep position. A 2019 study published through the American Stroke Association, drawing on data from over 4,800 adults aged 60 to 78, found that individuals who consistently slept on their backs, the supine position, had a significantly elevated incidence of nocturnal cerebrovascular events compared to those who slept on their left or right side. The association was particularly strong in participants with pre-existing arterial stiffness. Now, why does sleep position matter so profoundly for stroke risk? Because your cerebral blood flow, think of it like water pressure in a garden hose, changes meaningfully depending on how your body is oriented during sleep. When you lie flat on your back, gravity affects venous drainage from the brain differently. In people over 65 whose vessels are already less elastic, this can create temporary periods of reduced perfusion, meaning the brain gets slightly less blood and oxygen than it needs. If a clot or debris is already present in the arterial system, this is precisely the moment it can lodge somewhere it shouldn't. Here's what makes this especially urgent for those of you over 65. After age 60, cerebral autoregulation, your brain's ability to maintain steady blood flow despite changes in body position or blood pressure, declines by approximately 15 to 20%. Most people have no idea this regulatory capacity is weakening silently with each passing year. What most people get wrong about sleep position is assuming that any side position is equally protective. The evidence actually suggests that the left lateral position, sleeping on your left side, may offer a slight advantage for cerebrovascular drainage, consistent with the same reasoning that cardiologists use when advising heart failure patients. The practical correction here is straightforward. Place a body pillow behind your back to discourage rolling supine and begin training yourself to default to your left side before you fall asleep. Number 4 surprises nearly every patient I discuss it with, and the research behind it is more compelling than most people expect. It's nighttime blood pressure surging, a phenomenon called nocturnal hypertension. A landmark 2018 study from Kyoto University, which followed 6,300 adults over the age of 65 for an average of 4 years, found that individuals whose blood pressure rose rather than dipped during sleep had a 36% higher incidence of stroke and TIA compared to those whose blood pressure followed the normal nocturnal dip pattern. And here's the critical detail. The majority of these participants had blood pressure readings during the day that appeared perfectly normal. Why does this matter so much? Because your cardiovascular system, think of it like a plumbing network with a pressure regulator, is supposed to power down during sleep. Normally, blood pressure falls by 10 to 20% overnight. This is called the dipping pattern, and it gives your arterial walls a crucial period of rest and repair. When someone is a non-dipper, or worse, a reverse dipper, their arteries receive no rest. The walls sustain micro damage across thousands of nights, and fragile plaques that might have remained stable are instead subjected to continuous mechanical stress, making rupture or embolism during the early morning hours far more likely. Here's the aging-specific tragedy. After age 65, the prevalence of nocturnal hypertension more than doubles compared to younger adults. Yet because standard office blood pressure readings almost never capture overnight values, this condition goes undetected in the vast majority of patients. What most people get wrong is assuming that if their daytime blood pressure is controlled, they're protected. They're not without specifically knowing their nocturnal pattern. The clinical recommendation here is to discuss ambulatory blood pressure monitoring with your physician. This is a wearable cuff that records your pressure every 20 to 30 minutes throughout the night and provides a complete picture of what your arteries are actually experiencing while you sleep. This is a test that exists. It's covered by most insurance plans, and it can change your treatment plan dramatically. Number 3 is something you've almost certainly heard of, but I promise you haven't heard it explained like this in the context of nocturnal TIA risk. It's obstructive sleep apnea. A 2020 analysis from Johns Hopkins Medicine examined data from over 5,200 adults aged 65 and older and found that those with moderate to severe untreated obstructive sleep apnea had a 2.5 times greater likelihood of experiencing a nocturnal cerebrovascular event compared to individuals without the condition. The mechanism is both direct and devastating. Here's why this matters so profoundly for brain health. When your airway collapses repeatedly during sleep, your blood oxygen saturation drops, sometimes dramatically, sometimes dozens or even hundreds of times per night. Your brain, think of it like a high-performance engine that cannot tolerate even brief fuel interruptions, responds to each oxygen drop by triggering a surge of adrenaline to reopen the airway. That surge spikes blood pressure. Each spike stresses the arterial walls. Each episode of hypoxia, low oxygen, makes the blood slightly more viscous, slightly more prone to clotting. And it does this every single night, for years, while the person sleeping has no idea it's occurring. Here's what makes this especially alarming for those over 65. The muscle tone in the throat and airway naturally decreases with age. After age 65, the prevalence of clinically significant sleep apnea rises to an estimated 40 to 60% of the population, making it not an outlier condition in older adults, but nearly the statistical norm. And yet, fewer than 25% of affected individuals have been diagnosed. What most people get wrong is believing that sleep apnea only affects people who are significantly overweight or who snore loudly. In older adults, apnea can be present in individuals of normal weight, and it can occur with very subtle or even silent breathing disruptions. If you are over 65, have ever been told you seem unrested despite adequate sleep hours, or if you experience unexplained morning headaches or cognitive fogginess upon waking, push your physician for a sleep study. This is one of the most modifiable TIA risk factors that exists, and CPAP therapy, used consistently, has been shown to meaningfully reduce stroke risk in this population. Number two, and here's the one I teased at the beginning. This is something nearly everyone watching does every single night before bed, but almost certainly not in the way that actually protects the brain. It's hydration, specifically the timing and volume of water intake in the hours before sleep. A 2017 study from Harvard's T.H. Chan School of Public Health, analyzing health outcomes in over 20,000 adults followed for more than a decade, found a compelling relationship between nighttime dehydration and early morning stroke events. The research established that the hours between 6 a.m. and noon, the period immediately after waking, represent the peak window for ischemic stroke. One primary driver of that peak is the physiological state of the blood after 6 to 8 hours without fluid intake. Here's the biological mechanism and why it matters so much after 65. During sleep, you continue to lose fluid through breathing, through skin, through normal metabolic processes. You wake up in a measurably dehydrated state every single morning. When the body is dehydrated, blood becomes more concentrated and viscous. Think of it like the difference between water flowing through a pipe and a thicker fluid that moves more sluggishly. Thicker blood moves more slowly through the cerebral vasculature. Platelets clump more readily. And in a brain whose arterial system already carries decades of atherosclerotic change, this creates precisely the conditions in which a transient occlusion, a mini-stroke, becomes more likely. Here's the aging-specific urgency. After age 65, the sensation of thirst becomes measurably blunted. Research consistently shows that older adults can be significantly dehydrated without feeling thirsty. This means the body's natural alarm system is no longer reliable. You cannot use thirst as your hydration guide after 65. What most people get wrong, and this is the critical behavioral error, is either drinking too little water throughout the day or drinking a large volume right before bed to compensate, then disrupting sleep by waking to urinate repeatedly, which itself triggers blood pressure spikes and interrupts the protective sleep architecture the brain needs. The correct protocol, based on clinical guidance, is front-loading your hydration, consuming the majority of your daily fluid intake in the morning and early afternoon, tapering significantly after 6 p.m., and keeping a small glass of water on your nightstand to take 2 or 3 sips immediately upon waking, before you stand up, before you check your phone, before you do anything else. That small act of preambulation hydration begins thinning the blood at the very moment the stroke risk window is opening. Number 1, the most critical factor on this entire list, the one that over 70% of adults over 65 are getting measurably wrong, and the one that peer-reviewed evidence shows has the single greatest modifiable impact on nocturnal TIA risk. It is the management of atrial fibrillation during sleep. Specifically, the failure to recognize that AFib episodes preferentially occur during the nighttime hours, and that in many patients, these episodes are happening silently and have never been detected. A 2021 study published in the journal Circulation, conducted by researchers at Stanford University Medical Center, followed over 11,500 adults age 65 and older for an average of 5 years using continuous cardiac rhythm monitoring. They found that over 34% of participants who experienced a TIA or ischemic stroke had atrial fibrillation, but that in more than half of those individuals, the AFib had never been previously diagnosed. And critically, the majority of undetected AFib episodes occurred between midnight and 6 a.m., in the deeper phases of sleep when the parasympathetic nervous system is most dominant. Here is why this is the number one nocturnal TIA mechanism and why the biology demands your complete attention. Atrial fibrillation is a condition in which the upper chambers of the heart, the atria, beat chaotically rather than in the coordinated rhythm required to efficiently pump blood forward. Think of it like a washing machine agitator that suddenly starts spinning in random directions instead of its programmed cycle. When blood pools in the chaotically contracting atria, it forms clots. Those clots eject into the bloodstream with the next heartbeat. And because of the direct anatomical pathway from the heart to the brain through the carotid arteries, the brain is the organ most frequently struck. The clot lodges in a cerebral artery, blocks blood flow for seconds to minutes, causes a transient ischemic attack, and then, because TIAs by definition resolve within 24 hours, the person wakes up in the morning, perhaps slightly confused, or with a brief episode of arm weakness or visual disturbance, attributes it to tiredness or sleeping awkwardly, and never reports it. This is the precise mechanism by which a preventable catastrophe becomes an unwitnessed one. Here's the aging arithmetic that makes this terrifying and critically important. The prevalence of atrial fibrillation doubles with every decade of life past age 55. By age 70, approximately 9% of the population has clinically identified AFib. But when continuous monitoring studies are applied, monitoring that goes beyond the standard 12-second ECG snapshot, the prevalence of subclinical or paroxysmal AFib in adults over 70 climbs dramatically higher. The standard office ECG simply cannot capture an arrhythmia that happens intermittently during sleep. What most people get wrong, and this is the error that costs people their function, their independence, and sometimes their lives, is assuming that because they have never been told they have AFib, they do not have it. That assumption is only valid if you've been continuously monitored. A single ECG in a physician's office tells you only what your heart was doing during those 12 seconds. It tells you nothing about what it does at 3 a.m. The clinical recommendation is direct. If you are over 65 and have not had extended cardiac rhythm monitoring, a 48-hour Holter monitor, a 30-day event monitor, or a wearable cardiac patch, have a conversation with your physician about whether it's appropriate for you. If you have experienced any unexplained brief episode of dizziness, visual change, one-sided weakness, difficulty finding words, or unusual confusion upon waking, even once, even briefly, that conversation needs to happen urgently. Because a TIA is not just an event, it is a warning, and the data is unambiguous. The risk of a major ischemic stroke in the 48 hours following a TIA is as high as 10% without intervention. The window between a warning and a catastrophe is short, but it is a window, and the fact that you are watching this means it may still be open for you. Here is what I want you to carry forward from everything covered today. The brain does not get a night off. While you sleep, it is navigating blood pressure changes, oxygen fluctuations, cardiac rhythm shifts, and hydration deficits, all of which are invisible to you, and all of which compound with age. But every single item on this list is actionable. Sleep position, adjustable tonight. Nocturnal blood pressure, testable this week. Sleep apnea, diagnosable this month. Hydration timing, changeable tomorrow morning. Cardiac monitoring, a conversation you can have at your very next appointment. Print this list, bring it to your physician, ask directly, have we assessed my nocturnal TIA risk? Because if no one has asked you that question, the answer tells you something important. Your brain built everything you are. It deserves this level of attention.